Just want to let everyone know that we are live.
Okay, everybody, good afternoon. I'd like to call the meeting to order. This meeting is the Board of Health emergency meeting, Sunday, April 19th, 2020. Just to remind everybody that this meeting is being recorded by video and audio. Also pursuant to the governor's declaration of emergency, these meetings have been provided provisions under the open meeting law to be done remotely. Those are also attached to all the agenda, and anybody that wants to view them can, I think, read them on the town's website. First, I'd like to do an attendance by roll call, and I'd like to start with the Board of Health first. Well, James Cooper, just say present.
Present.
Rita Higgins.
Present.
Helene Weld.
Present.
Malcolm McNabb.
Present.
James Cooper.
Here. Present.
Also, we have Gary Shaw from Nantucket Cottage Hospital.
Yep, here.
Director of Public Health, Roberto Santamaria.
Present.
Greg Corbo from Town Council.
Present.
Leslie Snell, Assistant Director of Plus.
Present.
Jeff Carlson, Director of Natural Resources.
Present.
Don Holgate, Chairman of the Select Board.
Present.
And Libby Gibson, Town Manager.
Present.
Okay. Also, I just like to start by saying we're going to keep this meeting to strictly what's on the agenda, so that we don't get caught up in anything else that's out there. So I'd like to turn it over to Roberto to start.
Okay, so I think the first thing on the agenda is reopening the discussion for the construction emergency order. We had a discussion about the select board had it on Wednesday. We had one on Thursday, and then there was the joint meeting on Friday. There were some changes that were requested at those three meetings, and then I believe those changes went to staff and town council, and they have all been compiled to a list that's in the packet, into the final product that you see in the packet today. Really what it's looking into, this is technically the final draft, but the board would have to adopt it if they see fit today and set a start date. So I think we can just open it up to the board at this point, or if you want a brief overview from maybe what changes were from either council or plus, because this is the construction one, and then we'll move over to landscaping after this one.
Sure, we'll do that. We'll start with the construction first. Did everybody get the revised in their packet?
Yes.
There was just a few changes.
Mm-hmm.
So we'll start with any questions or comments about it. Just raise your hand if you.
I have one question, Steve.
Jim?
The number of workers for the construction is 4 workers plus one COVID liaison on the job? For a total of 5 people?
Yes, I believe so.
Okay,
If I'm wrong, correct me at any moment, Council or Leslie.
No, Roberto is correct. It's 4 workers and 1 COVID-19 officer, although the COVID-19 officer can be one of the workers, in which case then it would only be 4 people.
Anybody else? Should we?
well, I have one little question.
Go ahead, Jim.
Has the Island Lumber and the suppliers, have they agreed that they will in fact deliver all orders from their company to the job site? Are we okay on that? And are they okay on that?
To mine. Oh, Leslie.
Leslie? Yeah.
Okay, thank you, Mr. Chair. I've heard from Marine Home Center. They reached out to Dawn and the building commissioner and I and maybe some others. And they want to cooperate with the order, and they've said that they would like to have a list of the projects that are approved as they're approved so that they know they're delivering to sites that are in compliance with your order. So that's a good start. We have not heard from Island Lumber or Shepley or maybe other delivery companies. I did have a question, which is just jumping ahead a little bit further into the document about the deliveries. I thought that there was some discussion about only requiring deliveries for larger scale products like lumber, windows, that sort of thing, and not requiring it for the smaller items. So I think that still needs to be cleared up.
Are you having your meeting now?
Greg?
Yes, I agree with Leslie. So the version of the order that you have in your packet reflects the changes that I made after the joint meeting on Friday. I circulated that draft, and then Leslie responded with some additional comments and suggestions, and those comments are what you see in your draft. I've since responded directly to Leslie on some of those, and I thought that we could kind of walk through them. But I do agree that the delivery issue is something that we have to address. I found it difficult to come up with sufficient wording to capture exactly what it was that the boards were talking about on Friday. I did understand it to be that they would be required to receive deliveries of larger items, and that, the number of trips off the site should try to be limited, but it wasn't really clear to me as to where we should draw the line between what needs to be delivered and what can be picked up.
So what you're saying is, use some common sense. If you need to go pick up something that's small, that, box of nails, some caulking, or anything else like that you missed, it's easy enough to just get a curbside pickup. That's what I'm not trying to read too much into it.
So we can proceed on this, I think, in one of 2 ways. We could either take that requirement out and just sort of rely on the good faith of the suppliers and the builders to, adhere to this sort of best practice, or we can try to massage it in some way to make it more clear as to what's allowed and what's not.
Rita?
Steve, I tend to agree with you a little bit. I think it gets really muddy, and it all depends on whether or not Marine and Island Lumber and other suppliers are open to the public, or if they're only doing curbside. Because I think a lot of businesses get the bigger stuff delivered anyways, and that probably has less exposure to multiple people handling and coming in close contact with each other. So, I mean, I think if we're just talking about curbside pickup, then I think going to, call in a set of screws and whatever is fine. I do think it becomes a different issue if everything's open to the public, but I think it's actually reversed. The little stuff should be set outside, and the big stuff should just be delivered or put right into a truck. But, so I don't know if we leave it up to common sense or if we can try and make sense of this through regulation.
So what if we said,
Okay, go ahead, Greg.
what if we said supplies and materials needed for the work shall be delivered to the site by the vendor when feasible?
Yeah.
That's fine.
Mhm.
Would everybody agree? I see a lot of
Yes.
Yes.
So, Mr. Chair, I don't know if you wanted to go through then the rest of the comments that Leslie made on the draft.
Yeah, let's do that so everybody can hear it and follow along.
Okay. All right. So then the first thing that we see is under status of emergency order number 1. What we talked about on Friday was sort of trying to clarify the language in the first supplemental order as to, what constituted the type of emergency work on existing buildings that would be permitted to go forward. I had put in there, making a certificate of occupancy being the trigger point. But Leslie pointed out that, not necessarily all projects on the island get a certificate of occupancy. So the language that we came up with was before where it previously said that has a certificate of occupancy, it will now say used for dwelling purposes that was completed and occupied at any time prior to March 20th, 2020. So I think that creates a clear line between what's allowed and what's not. If it was an existing occupied structure, even if it was last occupied in September, you can do work necessary to make it habitable for the upcoming season. But if it's a work that you started building and just didn't finish before March 20th, then that's not going to be allowed unless it falls into one of the categories that we put down below.
Right. I think that clears it up pretty good.
Okay. All right. So then the next change we have is on page 2, under Part 1, allowable construction. We still need a beginning date for work. Leslie's suggestion is April 21st. I'll turn that over to the board to see if there's any other suggestions or if there's any discussion of that.
Does anybody have any comments on that date?
The only thing I would say is as soon as we agree on this, as soon as we can get this thing signed, I believe Leslie said that they're ready at the building department. So let's get going.
Kelly?
Yeah, and I think Don had requested Monday, but tomorrow is Patriots Day, so I don't know if staff would be available to begin the process of reviewing the requests. So.
Don? You're muted still.
All right, no, I think Leslie suggested Tuesday that maybe I'm sure they'll start getting things emailed in tomorrow, but probably that they would be able to issue things on Tuesday. So that seems fair.
Okay.
Yeah. Would everybody on the board have a consensus that Tuesday the 21st is fine?
It's fine with me.
Fine with me.
Okay.
Okay. Okay, so then the next change that we have, this actually comes up a number of times on the next couple of pages where we changed plus department to building commissioner. So you'll see that on the bottom of page 2 and onto page 3 in 2 places. And then you'll also see that under one person jobs. The other thing that we did for the one person jobs was add in the language about a registration form being provided to allow those to go forward. I know that was something that was of concern on Friday. And we also incorporated the language as to how you obtain a registration form.
Yeah, that looks fine to me. Does anybody have any? Rita?
For the single worker, do they have to be registered as a COVID-19 officer as well?
No, I don't think that the requirement for the COVID-19 officer would apply on the single worker job.
Okay.
Roberta?
So I was just curious, did we ever put in clarifications on what the single workers, does it include masons, painters, everyone? Because that's a lot of questions that we keep getting in an email. So we just wanted to make sure that who that means.
I did not put a clarification in on that. We certainly can if you think it's necessary, but the way that it's written now, really any work that can be done by one person can be done as long as they register and are approved by the building commissioner.
Right. I think that keeps it pretty simple.
Yeah, that's perfect.
Libby?
Just want to point out there's a couple of tiny typos in bullet number 3, Greg, under one person jobs.
Okay.
Work on a single project may be undertaken by more than one person, provided that only one worker may something.
Okay, yep. All right, I see that.
And then in the last sentence, under no circumstance shall more than one worker be on the site it's just a little extra space there.
Okay, I fixed that.
That's all.
Okay, so then the next issues that we have come under the application procedure. And as Leslie points out, these provisions don't really apply to the single worker. So I tweaked this a little bit so that the title of it will now say application procedure for multiple worker jobs. And bullet 1 will say to request authority to proceed with an allowable project, and then in parentheses, except for one person jobs with a registration described above, the attached application form shall be completed and submitted to the building inspector. The application shall be submitted either by hand, and then the remaining paragraphs will stay the same, because I believe now it's more clear that this section only applies to multiple worker jobs and not one person jobs.
Don?
Sorry, I just wanted to ask a question. Going back to the single worker provision, I just made a suggestion because this question came up to me quite a bit. That what if we got injured? Can someone check on them from time to time if someone's doing a single worker? Is there a way to write something in where the foreman on a job might be able to just check in so that they're not getting a violation if there's 2 trucks in the driveway for 10 minutes? Just something that's come up.
Jim?
Well, some one-man jobs are just one-man companies. They wouldn't have a foreman. They'd be all by themselves. Maybe a painter, you know what I mean? Or some electrician might be a one-man company. So I don't know how, unless you would designate people to just go around to those one-man jobs and just check on them.
There's just been a couple of concerns that have come up where there are many one-man jobs, and there were a million emails about those
Right.
that they can do independently. But then there have just been things that have come up, and I think that the hospital had kind of suggested that sometimes you might want to be able to check on someone.
I'm not sure if that really would need to be. I'm speaking for myself because I work by myself and I have my phone on me all the time. I mean, God forbid something really bad happens, and then it would take somebody finding me actually. So I think people just have to use common sense out there. Malcolm?
Just to reiterate, I mean, there are a lot of one-man jobs before the coronavirus, and we weren't checking on them. I think it'll get too complicated.
Okay.
Yeah, it was more people not wanting to get a violation if someone were to check on them.
Rita?
I'm just wondering, Dawn, because in a way what you're talking about applies to the 1 to 4 workers. So right now we've just essentially allowed 5 workers if one of them is a COVID officer. So do you feel that that wording should actually reflect 4 workers? You can have a 5th person on site if they're there to check on people. And then you could do something for the single workers, although I agree with others that, again, there's a lot of single person work going on anyways. But I think if we're putting it in for the single workers, then we should probably make us the same clarification for the 1 to 4.
I think that's already in there for the 1 to 4, that the COVID officer is the 5th person. But I don't want to complicate it. It was just a question that came up. That's
Is
why.
it for the 5th person, it's that they are a 5th person that's only there to check in, or that they can be a 5th person working on the job site?
I think the COVID officer is supposed to be there at all times, aren't they? So they're either one of the 4
Right.
or they're someone separate.
Right. So for the multi-person jobs, they can have up to 4 workers, which does not include the COVID officer. The COVID officer has to be there at all times. I suppose in theory, the COVID officer could also be a worker, which would then allow you to go up to 5. But, it's not an option to have the COVID officer coming and going just to check in on people.
Gotcha. Okay. So it really is then it's 1 to 5 workers, as long as one of them is a COVID officer and is there the whole time.
Correct.
Okay. Thank you.
Does anybody? Yeah, Greg?
Well, I just also want to address the concern that Dawn raised that, you might be a single worker and, someone just comes in to check on you. And, I've just pointed out that there is still remains enforcement discretion with this. And so, if you get a complaint that, oh, so-and-so is supposed to be a one-man crew and I see 2 trucks in front of the property, you can investigate. And if they say, oh, so-and-so just came to drop something off to me and left, or so-and-so is just checking on me, or I fell off the ladder and somebody is helping me up. Those are all things I think in your discretion, you can say, okay, well, we're not going to cite you for a violation this time. But, just be aware that we need to minimize the number of additional people that you have. So, you could still exercise reasonable discretion in the way that you apply this. But I think that, the general rule has to be that it's only one person on the job site at a time.
Okay. So,
Okay.
Yeah, go ahead, Greg.
No, I was just going to say, are we ready to move on?
Yeah, we're ready. Yeah.
All right. So I talked about the application procedure. Is there any questions about that?
I just wanted to, just because I know there's a lot of people watching, Leslie, can you let people know where they can find this application procedure?
So we haven't posted it yet. I believe it'll be posted on the COVID-19 page. We can certainly post it on the Plus page as well. The application for the 1 to 4 workers is included in the order. The application for the single worker we sent to you last evening. It's really simple. I'm already coordinating with IT to try to get a fillable form on the website so they can, fill it out and it will get emailed straight to the building commissioner. So that's in process. And the Builders Association said that they would work with us on trying to get information out once this is all finalized. So I think that will be really helpful.
Want to keep going, Greg?
Sure. All right. So next section is construction safety stand down. This hasn't changed since Friday. Did anyone have any questions or comments?
Nothing here. I don't see any.
Okay. Next section is zero tolerance for sick workers. This also hasn't changed since Friday. Any suggestions or comments?
Doesn't look so.
Okay. Okay, and then the final section is general on the job procedures. The only comment I received from Leslie was with respect to deliveries, which we already talked about. Was there anything else concerning the procedures?
Doesn't look so.
Okay, and then the final section is the enforcement section. Any questions or comments about that?
Steve, I have a question.
Jim?
Yeah, I want to back up just a little bit on that one that we just said. It said all materials received on the job is subject to a 24-hour quarantine. So that means if they deliver the material to the job, you can't use it till the next day?
That's correct.
So it'll sit outside on the job. And you can't use it till the following day. Is that true?
That's correct, yes.
I don't think anything that could be damaged by weather or
right.
Something very vital will be left outside by the people that are allowed to be on the job site. But
I think that could be a problem. Does anyone have any opinion on that?
Well, I think we should probably refer to Gary because we're hearing that there's mixed messages on how careful you have to be about surface contact. So if you've got, I don't even know what drywall that you might want to get inside, does it have to sit outside for 24 hours under a tarp? Do you have to plan differently? Maybe, but I feel like the hospitals, their message is changing a bit. And maybe if we don't have to wash down vegetables, you don't have to let drywall sit outside for 24 hours. I personally would err on the side of caution, but maybe the hospital has some, maybe the hospital will comment on that because I think it's a similar vein.
Yeah, this is Gary. Well, what I'll do is I'll pass that over to Dr. Pearl. She's not with me today, as I know she was on the call or on one of the meetings recently. I don't know if she might have made comments on that, but I don't have any. I'll just check back with her, and then we can give some guidance.
Yeah.
Would we leave it in then for the moment, and we can always look at it again at another time if it becomes an issue?
I think that sounds fine to me. Anybody else?
I think we have. I think we have to do that now, but I'm not concerned that much. We can ask 6 experts about this, and we'll get multiple answers. So I'm not.
I mean, if we if that does get taken out after, is that something that would have to come back to the board, or is that something Roberto could do by the declaration of authority that he has? I mean, that was just something simple to take out.
Well, I have one more question, Steve. If that happens and guys are on the job and they're waiting for a delivery to continue what they're doing, and the delivery comes and they can't touch it till the next day, that might mean that they have to leave the job.
Gary?
Yeah, I would think that's actually a question that Roberto can answer. I mean, he's the public health authority for the island, and if there needs to be some medical context around a particular recommendation coming from the health department, he can join Diane in getting that for us. But Roberto, what are your thoughts?
Honestly, I think it's a best judgment thing. If something like drywall, if it's gonna rain, they're not going to deliver it. If it is raining, they're not going to deliver it. But if you can get it brought inside and then it can sit there for 24 hours, then so be it. The leaving the job site part, I understand that. But also it's a matter of, if you know if you have an immediate emergency job to repair, for example, like somebody's hot water heater is broken or the water stops working mid-shower, that is an immediate work, and I can see how you can get that immediately and you wouldn't have to quarantine because those are emergency repairs. But something like you're going to install a whole new hot water heater in a building before, and you know it's happening, order it a day ahead of time and have it delivered a day before you get there. It's a logistics thing, is really my gathering. And also, we, in the guidelines that are being sent out, we have with all the construction sites and all the COVID guidelines, it specifically says how to sanitize and disinfect the workplace before and after you begin the work and finish the work. I think, like Malcolm was saying earlier, I don't think we should make it too complicated.
Malcolm?
I would suggest that we leave it in for the time being, but give Roberto the authority to take it out after consultation with whoever he wants to.
Yeah. Any other questions? I think that's a good remedy to that. Rita?
I agree with that. And I, to be honest, I think it's going to remedy itself, because I think that people are already going to be planning very differently than they have before. And I think that deliveries on a good day were already hard for the companies to organize. So if you don't order your stuff in advance anyways, you're going to have trouble getting it. So I think it's fine to leave in, and I agree with Malcolm. It's fine for Roberto to have the authority to remove as needed.
You get that, Greg?
Yeah, so I'm not going to do anything with that at this, and we can deal with it at a later time if we decide there needs to be a change.
Okay. Malcolm?
Well, I don't want to have to call a whole meeting again just for it. I think we should, when we approve this, which I assume we are, we'll put a rider in the approval that particular paragraph or sentence can be deleted with the authority of the health director.
Yes. Yeah.
Because if we have another meeting, we'll talk for 5 hours on it. So.
Okay.
So what if we added in a qualifier then that said, at the discretion of the health director?
Perfect.
Okay. Okay. All right. Are there any other questions or comments or anything that anyone wants to see added or changed or taken away?
Rita?
I just wanted to get a sense of the board. I know it came up at the last meeting, but it's something that has been repeatedly asked of me is the requirement or recommendation that anyone coming from off island isolate or quarantine for some certain amount of time. We've already added in preference. Some people, quite a few people feel that's not strong enough. So I just wanted to get a sense of the board, this board's thoughts on that.
Anybody have any thoughts on that?
We did say that it was a preference, but that if someone came from off island, they could stay on island for that self-quarantining period. I think that is written in there, is it not?
So what we said was hiring preference shall be given to workers who reside on the island or who are able to remain on the island for the duration of their work. I do not believe that we adopted any sort of quarantine period for workers who come off island.
Okay.
Theoretically, under the stay-at-home order, still, unless you are considered essential, which would probably fall under the, maybe the guidelines of the affordable housing and essential buildings that need to be done. If you other than that, you would have to quarantine, I believe. Wouldn't that how it would read, Greg?
Just give me a second on that one. Let me pull up that stay-at-home order and see. I mean, my understanding would be that once you allow this to go forward, it constitutes an essential service for purposes of the governor's order. And so I would think that the stay-at-home does not apply. And honestly, I mean, the reason I didn't put any sort of quarantine in there, and I'll leave this up to you for discussion, but that it seems like it would be very difficult to get a job done with 4 people if some or all of them had to quarantine for 14 days before they could do any work.
Dawn?
I think that under the stay-at-home order now, it's directed to people who travel from out of state. I'm a little bit worried with getting into that, and if I need to go to Hyannis to get my car repaired and I come back, do I have to quarantine for 14 days because I've now been exposed potentially to someone in Hyannis? I'm asking to see what we're really looking for there.
Yeah, it gets pretty complicated. And I personally, this is me, I don't see maybe that many people that would be allowed to, how many people are going to be coming off island for this? I don't know. We don't know until we turn the dial up a little. So
according to the town's website, the emergency stay-at-home order expired on April 6th. And then it says governor's emergency order in effect until then. And I do not believe that there is anything in the governor's order that relates to travel to and from Nantucket or really anywhere else other than the guidance that people who are coming in from out of state should self-quarantine for 14 days. So I believe that the way that the orders are right now, anyone could really come and go from the island without having to quarantine, including those who are coming for purposes of doing work under this new order.
Rita?
And just to clarify that is, I believe that there's an understanding that's what currently exists. I think there's just a concern about the construction workers that'll be coming over, but not just construction workers. So I just wanted to put it out there. It's been something that's been asked to me repeatedly, so I felt it would be valuable to have that discussion and get any clarification. and it seems that there doesn't seem to be any interest or logic in trying to limit off-island or even legal capacity to be able to do that. So it's open to anyone, no isolation.
Greg, thank you.
Yeah, I think, as I've said before, that we're entering a couple of phases here. Obviously, some recommendations to slowly take the brakes off with the regulations that you're allowing. The second part is education to answer questions that Don just asked and the public's asking, probably in two ways. And Roberto and I have been linked with Senator Sear and Representative Fernandez to develop island-wide and Cape-wide recommendations that would give the public, both that are transitioning from within the state, an understanding of the relative risk that they're entering and things that we would want to see behaviors to look like. There's good behaviors and there's not good behaviors that could add into the COVID initiative for spread. And then there's the third document that we're working on now, which is for folks coming in from out of state that probably don't fully understand the success that this community has had in straightlining out the number of COVID cases. And so we're working on a plan right now to get a letter written that can be sent out through associations that members partake in. Apparently, not everyone out of state is looking at our website or looking at the town's website or heard the broadcast. So those three pieces are working in sync to not only help us with worker understanding, but then help us with people transitioning back and forth to Don's question. And then those that would potentially be coming from out of state that under that regulation from the governor, is my understanding that 2-week quarantine at home would be there. The components in that education, what we're working to put together for the outer staters coming in, would also have in it some recommended guidance on if you get here, go to your homes and welcome home. But here's the way that you can stay at home for that 2 weeks and have things delivered. And here's the companies that deliver them. And here's what, when you go out in town, here's what we would hope is social distancing and those things that occur, according to the governor's recommendations. So we have to be clear on, not only are we letting some work begin, but we have to be clear on those other two parts, I believe, so that we have a full understanding of the 360 that we're facing here. And if I've missed a category, Roberto and I or any of you can talk that through. And then I think you have a better solid plan on looking at how transition occurs on and off the island and what those behaviors and expectations would look like.
Any other comments? So I that sounded great to me, and I don't think we need to overcomplicate these orders here.
So is there any other question, comment, issues with respect to the Back to Work program for construction phase 1?
Any other comments from the board or anybody else? I guess seeing none, do we want to move on to the landscape part and then at the end of towards the end of the meeting, accept them, or, get a motion to accept these orders at the end, or Roberto?
All three orders are separate. So I would say, why don't we go ahead and vote each one of them separately, just to have those 3 votes on record.
Okay.
They can still be done at the end. It just, we will just.
Yeah, I know we're going to do them separately. I just was wondering whether you want to do this one now or Rita?
Can we do them at the end in case anything comes up that applies to a prior one that we didn't foresee?
Right, have to come back to, okay, yeah. So we'll move on to the landscape order, number 6.
I'll yield the floor to Jeff on this one.
Jeff?
Yeah, good afternoon, everybody. I think what we put in there, I don't want to kick the can to Greg a little bit. I know Greg made some changes from the meeting on Friday to today, and then I had a couple additional comments, so I don't know if Greg wants to walk through the updates that he made, and then we can talk about the comments specifically, or how you guys would like to take that.
Yeah, we can do it the same way. Greg wants to start.
Sure. Okay. Basically, what I did primarily related to format and structure in order to make this a separate document from the construction document. So in the first section, purpose, you'll see that this section only relates to landscaping work and why you're instituting these protocols for landscaping. The second section, status of emergency order number 1, I pared this down from what's in the construction document because I don't think there's any reason to have it in 2 places. And really all that was necessary here, in my opinion, was just to explain that to the extent that emergency order number 1 prohibits commercial landscaping, it will now be allowed subject to the terms of this order. Are there any questions about these first 2 sections?
Rita?
I just want to ask for a clarification that it really now applies to any commercial landscaping. I've been fielding some questions about how the state is defining essential services and landscaping within that. So this isn't about just things that are the safety, maintenance, sanitation, that whole phrase for a site. That this means that we're talking about any commercial landscape service. And part of that as well, and you might be able to help with this, Greg, is there's a question about whether or not this applies to office managers for landscape businesses. So does landscape services cover are they a landscaper? Are they covered by this?
So I'll take the second part of that first. I mean, if you're an administrative support person, I do not believe that is covered by this particular order. Although I don't know that there is anything that would prohibit an office or administrative person from doing that type of work, as long as they maintain appropriate social distancing or work from home protocols, much like the rest of us are doing at this point. As to the scope of landscape under the governor's order, I think I would be interested in what Jeff's interpretation of that is in terms of the industry.
Jeff?
Sorry about that. I was just trying to unmute. Yeah, I think to try to take that a little bit and kind of break that down, my understanding for the administrative portion is, people are obviously still able to work remotely, but administration necessary enough for day-to-day operations to continue. As far as other work that's there, I mean, the document itself calls out at the top that new installations were not included in the protocols specifically. And then we got into a little bit of the discussion about what a single worker would be able to do by themselves. So I think, I would turn that back to the board a little bit about if they want to leave that single worker to the allowable activities listed below, or if they would want to open that up fully. I think that's something for you guys to decide.
But Jeff,
go ahead.
My understanding is that under the governor's order, landscaping is qualified as being essential only if it relates to certain types of work.
Correct.
But I'm not quite sure that that's how it has been interpreted statewide. And, you know, the caution I would give is that while we've given the opinion that municipalities have the authority to enact regulations that are more stringent than the governor's, I don't believe that you have the authority to enact regulations that are less stringent than the governor's. And so caution against any work that is not allowed under the governor's order.
Correct. So I think the intent originally was to focus on preventing, you know, plant loss and health problems to the landscape, where you could be creating situations where you may have, you know, an increase in pests or, you know, nuisance vegetation, or, you know, plants that are now dead and dying and creating other potential hazards, creating habitat for insects and things like that. I think that's why the initial charge and initial push on this was to maintain landscapes in a safe and healthy manner, to try to prevent that and to try to stay within that kind of basic site sanitation that the governor's order allows for.
So what the governor's order says is that landscaping is allowed if it's necessary to maintain the safety, sanitation, and essential operation of residences, businesses, and certain other buildings. And so, Jeff, is it your interpretation that everything on your list fits within that category?
Yeah, I think in my research around and how that's being interpreted, I think the maintenance of plants that are in place in a healthy manner fits within that. I know there's some discussion of whether some of the activities, obviously some of those debates come in, things like mowing is, I know, a highly debated topic for a lot of those. But I think, you know, looking at kind of the National Landscape Association guidance and some of the guidance that's come out of the state as well, where they feel like maintenance of that, as far as providing, you know, a maintained area that's not increasing habitat for things like ticks, for noxious weeds potentially, or other things coming in, is something that they've been recommending. That's why it was included originally in this, for some of those things. Pesticides have been allowed under a lot of these, obviously, for maintenance of insects and other things that come into there. So I think a lot of those things have been included and fit within that, certainly. I don't think we've put anything here that specifically doesn't really go within that too much. Just as an example, and then I'll stop talking, I promise. We specifically limited the work on trees and shrubs to pruning as needed to maintain plant health or for safety purposes. For that very reason, you know, we don't want people to take down a tree because they want to take it down for aesthetic purposes, but if it's been damaged in a storm or has wind damage and needs to be taken down for a safety purpose, that a crew could go out there and safely do that with the two-man crew. So that's kind of a more concrete example, I guess.
Rita?
Is the one-person exemption then at this stage irrelevant? Because if you can't do any of those activities that don't fall within the state's definition already, then it doesn't matter. We've already allowed 2 people to do it. So having a one-person exemption doesn't really matter, does it? Because if we allow a one-person exemption saying you can do whatever you can do as one person, then that sounds like it's looser than the state standard.
Do you want to take that, Greg?
I do, but I just need a second to open some document here. Give me one moment, please. Sorry. So, the governor's order has this exemption in it that says that businesses and other organizations that do not provide COVID-19 essential services are encouraged to continue operations where they are able to operate through remote means that do not require workers, customers, or the public to enter or appear at the brick and mortar premises closed by this order. It's not entirely clear what a brick and mortar premises would be for a landscaper, and whether this order would prohibit a single landscaper from doing their work. Again, I'll ask Jeff again if he knows through the industry, how this has been interpreted.
Jeff?
Yeah, again, I mean, for what we've seen and kind of looking around, it's really been a bit of a mixed bag for how people have been interpreting it, and it's really been seemingly a little bit of a patchwork from community to community on how they're enforcing that. So, I tend to agree. It's a lot of gray for what that looks like.
So, one thing that we could do, with respect to this one person exemption, is we could say any landscaping work that can be safely performed with just one person on site, to the extent permitted by state law.
That's a good idea.
Rita?
I think that sounds good on paper, but I think we're going to get thousands of questions about what that actually means in practice. So I think it's probably better to either keep it simple and just either keep in that, I don't know what the simplest one is. It's probably taking out the one landscaper exemption. But I don't know. I think that will be too complex because if nobody else is worried about this, please chime in. I'm just bringing up, I'm fielding a ton of these questions and I have to answer them for myself and anyone who works for me. So there's a lot of us and we're going to be asked to clarify this. So I think for, again, the sake of clarity in the next 48 hours, we should answer them as simply as possible. But again, if nobody else cares about this, then let's just do what's easiest.
Malcolm?
Well, I think I care about it. I just am as confused as apparently the rest of us are.
Jim?
I think we need to leave the one person in there. Because there are a lot of people who have very small businesses. There's only one employee, and that's themselves. And I think we need to let them in there. How we're going to do it is another thing. Maybe we have to keep talking about this, but I don't think we should do away with the one person job. I think it's essential.
Rita?
My question then for James is whether or not you feel their activity should be restricted to the same ones, the ones that are in this document, or is it left up to their discretion? Are they allowed to do whatever activities they want as one person?
No. I think we should decide what they can do as a one-man crew. But don't do away with the one-man crew. But if we're here to decide what they can do, let's decide what they can do, and then we'll move on.
Greg?
So, I mean, to Rita's point, right now, the way the regulation is written is you can have up to 2 people and a COVID-19 officer doing the activities that are listed in the document. If single person crews are only allowed to do the same activities, then there really is no reason to call them out.
That sounds pretty simple enough to me. As do the same work as the other having 2 in the COVID.
And so to clarify, essentially then that's whether you're one person or two people, the only activities you can do are the ones listed in this document.
Yeah. Mm-hmm.
Okay.
That's how I read it.
That's how I read it, too. Any other comments, or we'll just have Greg move on?
Okay. All right. So I last left off after the status of emergency order number 1. So part 1 lists the type of allowable landscaping. And so, you know, I haven't made any changes to this, but I defer to Jeff as to, you know, if there are any questions. I do see he has a comment that in the previous draft, these activities were to be delayed a week. So I guess the question is, do you want to delay these a week or have them be allowed to start at the same time?
Jeff, and I think that's to do with the secondary activities.
Correct. We had originally drafted that to be a week delay to kind of evaluate how the program was going for the first week in compliance and if there have been any issues in an effort to kind of roll this out in a very controlled manner to some degree. And then that was moved just into the list into this draft. So the intent of that week was, again, to give a chance for you guys to evaluate how the first week went. And then if you felt that it was going okay and compliance was where it needed to be, that those secondary activities would be available for those crews to do.
Rita?
And just to sort of clarify where the primary secondary came from, it was, albeit a brief discussion Jeff and I had about things that are time sensitive or season sensitive, temperature sensitive, and what is sort of essential. So what really, you know, now is the time to do it, or it's, plant loss, plant life is more important. To again have a slightly slower rollout, slightly, because a week is really not that much time. So the secondary activities are ones that aren't as pressing or as essential right now.
Is everybody fine with that as the secondary activities, with putting the wording into, you know, follow up a week later?
I'm fine with that.
Me too.
So I know, yeah, that was in a previous draft, so you're actually just going to put that back in there.
Okay, so the change I'm making here is under part 1, allowable landscaping. It says the following landscaping activities may be performed by commercial landscaping companies, provided that the work is done in accordance with requirements of this order. Then I have a new heading, primary activities. The following activities may begin on Tuesday, April 21st. And then we list out initial site openings, greenhouse growing operations, irrigation system, lawns, trees and shrubs, golf courses. Then we get to secondary activities, and I added the following activities may begin on Tuesday, April 28th, 2020.
Is that okay?
Yeah.
Sounds good, Greg.
Okay. Okay, and then in the next section, to reflect the discussion we just had, I crossed out one person and the first bullet point, any landscaping work that can safely be performed with just one person. So now this last section is limited only to private jobs, which is essentially, you know, work that is being done by people on their own property for their own benefit. So are there any other questions about the type of work that's going to be allowed?
Did you raise your hand, Don? No. I think Nobody's raising their hand, so.
Okay. So then moving on to application procedures. These are similar to the ones that we had for construction. I see that Jeff had a few clarifications that he wanted to see put in there, and all those look fine to me.
Jeff?
Real quickly, I have been talking about setting up a dedicated email address for this. I'm not sure if we're going to roll this out on Tuesday, if that's going to be set up on time. So I guess if we could change that email that's listed there where it says landscaping@nantucket-ma.gov back to probably my email address. So that would just say jcarlson@nantucket-ma.gov. And then if we have a secondary rollout, we can notify that there's a secondary address or put the link on the webpage.
Okay.
Yeah. Okay.
Okay. Any other issues with the application procedure?
Jeff, we did, you put in the thing that the landscapers would do their applications for jobs and everything through your office?
Correct. So I actually listed out of the Board of Health or our office, but all of the mailing addresses and contact information is to our office specifically.
Okay.
Very similar to how we run the fertilizer program.
Okay, we're good on that.
Okay. So then moving on to safety stand down, I believe that this is identical to the construction sections. Are there any questions as they relate to landscaping?
Doesn't seem so.
Okay. Next section, zero tolerance for sick workers. Again, this should be identical to the construction section. Any questions about that?
All good.
Okay. And then general on-the-job procedures. Again, this should be identical to the construction, with the exception of no more than 2 people being on site. And I'll have to go back and tweak this in the same way that we tweaked the construction document just a little while ago. I don't think there was a significant number of changes there. But whatever they were, I'll make sure that they get put into this one as well. In fact, it looks like the only real change there was to change the delivery of supplies shall be delivered when feasible. I don't think we changed anything else. And then enforcement is identical.
Rita?
I just wanted to make sure again that maybe Jeff can just sort of state for the public where this is going to be. I also wanted to know if, probably applies to construction as well, if these are going to be made available, I don't know, on the website in Spanish, maybe Portuguese, but I think it would be pretty important for these to be in Spanish as well.
Yeah.
So yeah, we'll have it up through the COVID link as well. We'll also be emailing this finalized document to everyone that we keep in our commercial fertilizer license database. So everyone will get an email copy. It'll be available there. I believe it's the intent, and I'll default to Roberto for this because he's the one that's facilitated this before. We'll definitely be getting it into Spanish. We've also had a number of landscaping companies that have reached out to us and have offered services to translate it probably into Portuguese and Bulgarian. And I'd have to go back through my emails. There was one more language that someone said that they had someone on staff that could translate it into something else too. But our intent would be to work with anyone to get it into whatever language necessary to get that to the people for them to be able to understand.
Great. Yeah, I'd love to see that ASAP.
Yes.
Yeah, we can definitely get all of these translated into at least English, Spanish and Portuguese through our in-house ability as well, and then we can get those out to the COVID information, get them out to as many of the communities as possible through foremans and the construction work corporations and things like that.
Yeah, these forms will also be on the Board of Health website too, besides natural resources.
Yes, we're gonna make these as available as possible.
Okay, any other comments, or are we good on order number 6 for now? And Rita?
There were just a couple of things while we're talking about language. Some of the concerns that I've had but have also been communicated to me are back to the health insurance that, and Gary might be able to help clarify. It's just the swab, I think, that is covered, not if you actually get sick. So you'll have to have your own health insurance, and if you don't have it, then you'll have to figure out how to pay. So the hospital is covering the swab only. So I think if there can be information for people in English and Spanish about that. Childcare has come up quite a bit. I think landscaping is disproportionately impacted because you've got a lot more women going back to work as a result of this, and quite a few members where they've got a construction worker and a landscaper, so there won't be any childcare per se. People are very concerned about losing their jobs if they can't go back, so I think legal information that Greg provided us last time should be made available. And Roberto, you did say there's something being worked on for childcare, and if you could explain that, that would be helpful.
Yes, through Taylor in my office, Taylor Hilst. She's working with EEC. I forgot what it stands for. Early something education. She's working with the state offices to get the child cares up and running. There are a few sites already available, so we're going to try to get that information out more. They're already available on the state site. And I believe we have 3 sites available on Nantucket. So what Taylor's trying to do is expand that program to make it available to more people, and we are going to translate as much of it possible. Once we get that information up off the ground and up and running, we'll get all the information out to as many people as we can. We do expect it to be, with the 3 that are already available, you can already call them, but we do expect it more to be up and running as soon as possible for as an expanded program.
Maybe Gary wanted to answer that healthcare question that Rita brought up.
You mean the one about the swabs?
Yeah.
Yeah, I sent her a document that's from Partners that describes the swab coverage, and then also supplemental insurance options that people can pursue. I don't have the document in front of me right now, but it is available at the Cottage Hospital, and I believe it is in multiple languages. So if we need to provide it to you, we're certainly happy to do that.
Rita?
Yeah, sorry, I didn't get a chance to, I haven't seen the document yet, but it is, so, because I think there's some misunderstanding. It's the swab is covered, so if you're concerned, go to the hospital, get the swab, that's covered. If anything happens subsequently after that, then there are options available if you don't have health insurance for assistance with coverage, but you have to seek those out. Is that just the simple? I'm asking because I've been inundated with those kind of questions, and there's a lot of people watching right now, so I think it's a good opportunity to clear that up.
Right. You're right, Rita. In fact, that's something you might want to take and post on your website so folks can see that. In fact, just because of the number of questions that are being asked, I'll ask our PIO to put it on our website as well. Helpful just to be able to refer to it. Thanks for bringing that up, Rita.
Yeah, I think you answered that a week ago about that too, also in the select board meeting with insurance, or if you didn't have it, that people wouldn't have to worry about it. So, are there any more questions on the landscape order before we move on?
I'm just wondering, Steve, if at some point you'd like to have me give a current update. This may not be the point in the part, but let me know when.
Okay. Well, I don't think this next order will take long to get through. So we'll have you do that right after this.
All right.
Roberta?
Okay, so the next order is a masks order. So these are already guidelines from the CDC that we've been looking into, that some or retail establishments are already following, but the big ones that we have on island, we keep getting complaints about how the employees aren't wearing masks. So what this order is for essential workers. We use the Plainville order as the template. Section 1 is to make essential workers wear masks. Section 2 is to post a sign recommending masks. And then the subsections A, B, C, and D. A and D are just reiterations of the governor's orders. B is the creation of a COVID officer, which we're creating everywhere. And in the retail establishments, it's like the person in charge. For the food establishments, which is the manager. And then C is to close non-essential areas of the store. So when Greg and I had spoken about this earlier, when town council was reviewing it originally, C was for areas of certain Stop and Shops, mostly you see them off island more, where there's multiple businesses inside, like a flower store, things like that, little things like that. So it's just a recreation of the Plainville order. Worcester has already passed this order. Plainville passed this order. Brookline passed it. Quincy passed it. We received a letter this morning from school board in Barnstable asking us to pass it today, and sent it to all the health agents on the Cape as well. It does say that it passed on Friday, that it passed on Thursday and it was implemented on Friday. That's my fault. The date should have been blank. That's a holdover from the Plainville order that I just didn't release, that I didn't delete. So it looks like it is already in effect, but it's not. So I wanted to bring it to the board. Like Steve mentioned earlier, that we do have the delegation of authority. So I could have passed it, but at the same time, I'm not an appointed king, and I want it to be brought here. And I want you guys to look at it, and I want you guys to vote on it. To pass something like this just unilaterally would be not in the best interests of any good government. So I just wanted to bring it up to your attention and see what you guys had questions on. Town council and I reviewed this over the past few days, and this should be just up for your review here.
Yeah. Have you had any conversation with Stop and Shop, with managers?
We have had conversations with them. There's a few issues with them issuing their internal policy. Both mainly because it's a change of working conditions. So a lot of that ends up having to get bargained out through their union. So there were some issues there. So you do see some employees wearing masks, some don't, because it is still voluntary on their end.
Any other questions or comments, Rita?
I just had a question, Roberto. You were saying that A and D were really just calling out portions of the government's order already. The C, who would that apply to? Like, can you give some examples of how that would be like the coffee and Stop and Shop, the beans presence in Stop and Shop. What other businesses? How would it? Who's going to be impacted, and what are some examples?
So on island, the bean, if I'm not mistaken, is already permitted, and they're technically allowed to still work because they're a fully takeout group. Yeah. But it's certain sections. So Stop and Shop voluntarily closed the bakery. But that would be one of them where they had a custom bakery, custom slicing of the hams, things like that. They voluntarily closed that, but at the same time, it reiterates that. Here on Island, I think Stop and Shop is the only one. It would, because Marine Home has already moved to curbside delivery, it's not an issue. But for example, the coffee service that's in Marine Home, they just have that the coffee thing. It would require that closes, just because it's too much handling and it's not essential to the service that they do. So it's a few minor changes. It's not huge and impactful to any of the businesses here on the island. If that gets removed, it's actually not that big of a deal because it affects mostly off-island businesses. Like I said, we use the Plainville order as our template. It affects a lot of the businesses in their stores, but not so much here. Section C is really, it's kind of superfluous, but it's also was already in there. I don't want to reinvent the wheel.
Any other comments? Dawn? Dawn?
All right. What if employees refuse to comply, or what if they, take their masks off for certain reasons during the day? I think most people want to wear masks, but I'm just not sure why more regulation is needed at this point with our current status, and why couldn't we just encourage voluntary compliance and best practices rather than issuing further orders? And I'm really worried about that section that cordons off pieces of businesses. It seems like it actually would apply to more than what you guys are talking about. If Marine Home Center were to reopen at some point, I would think they'd have to cordon off the entire furniture department. I just don't know if we want to get into that kind of level of micromanaging the businesses on Nantucket. That's just my input.
If I'm not mistaken, the governor's orders, when they do, and even our orders, when we talk about non-essential workers, I think it depends on each individual business to declare which individual worker is essential for their business. I think the furniture is actually essential to their business because that whole section is a furniture store. Greg, correct me if I'm wrong on any of this. I wouldn't expect that the furniture would be shut down once they're allowed to, if it is a non-essential business, as the governor, if that is still closed, once it reopens, the way they define their essential employees would be up to them. We're not going to micromanage them. But before I yield the floor, like you said, if an employee has to take off their mask for certain things, the here and there, and of course, we're not going to be draconian, but we're asking is that when they're on the floor working with the public, that's when they need to wear the masks, mainly because as the island starts coming back to life, as businesses start coming back to life across the state, more and more interaction is going to happen in these sales floor type areas. So as grocery and retail are really our lifeline to our economy here, we're looking to just make sure that they're protected as much as possible, for lack of a better word. When we ask for voluntary compliance, you end up dealing with what's called the Pareto rule, where 80% of the people will comply voluntarily, 20% of the people don't. So we end up spending tons of time to track down those 20%. And it's just it's just a big risk at this point, especially considering Massachusetts is on its uptick. We're on our surge, and we're looking to reopen parts of our economy during that spike. Massachusetts is ranked number 3 in the country right now with our cases. So I feel like just having the masks is a nice way to slow down the surge a little bit.
Rita?
It sounds like this order is one that is more of a longer term, looking at how we are sort of picking things up again. Some of the other orders we've been looking at, there's been a short time frame on them, and a plan to expand. Whereas this one, and I could be wrong, Roberta, I'm just trying to understand that this one we're putting in place sort of not in perpetuity, but we see this as part of the bringing more people back to the island, and this is something longer term for businesses to take into consideration.
Roberta?
Yes. So what we're looking at is that intermittently we're going to have to, until there's a vaccine, in the presentation on Friday, as Dr. Drazen was explaining, we're going to be seeing intermittent times of required social distancing across the country until there's a vaccine. There's going to be moments of, where there's going to be flare-ups of COVID and things like that. Having the masks in place is more of a long-term issue, and it's in full recognition that we're gonna have people here. There are people coming. There's the summer is here, and unfortunately, fortunately or unfortunately, however it is we want to say, the summer people are coming, and we're not going to stop them. And this is just a barrier in place to slow down the spread and prevent the surge or mitigate part of the surge. The Johns Hopkins guidance for reopening that was just released for the governors and everything, on page 10, it even specifically says any open business should require PPE. So, and the governors should require it, is what the guidance is saying.
Dawn?
I would just really request that you take public comment on this and actually talk to all of the impacted businesses. I mean, I do not have any problem with the discussion of masks and protecting people, but I think that for the pharmacy or Hatches or some of these small businesses to have to hire an additional employee to stand at the door, the way this reads just seems very geared towards big box retail with a lot more staffing. And I'm just worried about how much our businesses are struggling right now anyway. And if it's really necessary, I know what's going on in the rest of Massachusetts. It's really bad, but it's not at the moment happening here. And you maybe have a little bit more time to consider this and rewrite it a little bit more Nantucket specific. That's just my suggestion. I don't know. I don't feel a lot of need to go above and beyond the governor right now for us, and maybe we will have to, but I'd just love for you to get more public input.
Any other comments from the board? Rita?
Is it your officers and your current staff that would be enforcing this if it was in place, Roberto? And then are there fines associated with these violations, or how will that work?
So technically, as a regulation in this under Section 31, we can also fine under Section 122, but we're not looking to fine anyone. Now we're even with the construction moratoriums, I'm not even sure that there's been a lot of fines given, if any. So what we're looking to do is get these in place. It's a point well taken that we're not the mainland. We're not looking for anyone to hire anyone new. It's small stores like the ones you see on Main Street and stuff. You do see, you can see the whole store from the back. We're just asking that the manager keep vigilance on it. It's not necessarily that we're asking somebody to stay at the door. If I'm not mistaken, we're just asking that there's a sign at the door. I think that's section number 2 on it. We're not asking that somebody actually sit there, but to the extent possible, slow down large groups of occupancy.
Roberta, why don't you tell everybody all the calls that the Board of Health has received about it?
So there's a huge influx of complaints. about retail workers not wearing masks, especially among the elderly population. I can forward some of them. Definitely, I'm not going to go through my email and forward easily the triple digits of the emails we're getting. Steve, I know you're getting them. Malcolm, James, Rita, Colleen, we're getting countless emails about all the decisions we make, both positive and negative, supportive and detracting. It's just we're getting a massive amount of complaints regarding specifically Stop and Shop not wearing masks, but for example, some of the pharmacies aren't even allowing people in the store anymore without a mask. So it's an unprecedented time, and these are all definitely difficult decisions, and that's why I want it up to the board, and I didn't make this decision unilaterally.
Yeah, I think it's it's a common sense the way it reads to me, and as things move on, it can always be revisited. Anybody else have any more comments? Dawn?
Are you going to allow public comment on this?
I'm not. I mean, I'm not sure if we are, especially not at this meeting. I think, Roberto had the authority to put this in. He didn't need us. He just wants to get our approval today. And I'm of the consensus that I have no problem with it. I don't know how the rest of the board members feel. Rita? You muted.
A question for Roberto as to Part B. Well, so just to clear up too, because in number 2 it says these are recommended. These aren't recommendations. These are going to be mandated. And then section B, thinking about some of the size of some of the stores that we have. One, who determines how many people per shop, and is that posted on the sign? Just thinking a little bit to some of our fire safety regulations. How do we make that clear? Who knows? Do you think it's essential for this to be as effective as we need it to be to have COVID-19 safety officers stationed at doors? To your point, there's some of the stores you can see into. Just that's the part that stands out to me the most.
As far as a COVID-19 officer goes and the occupancy goes, the state retail reiteration that is in A and D is asking retail to limit to 40% of their occupancy. That's already in place. I don't know, even right now, the only group that I know of that has a person at the front door clicking how many people are entering is Stop and Shop. So we understand that there is a lot of work that needs to go into this, which is why we're not looking to bash people over the head with it. It's, if you want to take out section B, or at least the part that requires the COVID manager to be at the near the door, it says, as long as we have a COVID-19 officer that is monitoring the activity in the store, on the sales floor, everyone knows, every business owner knows what's best for their own business. If, as long as they're monitoring it, and when we check in with them, they can, give us the information that it is that they're looking to do, I think that works. Yes, and we have the staff that is looking to do this. We're actually, right now, we have a seasonal inspector that's looking to start in the summer. So I think it's part of the process. But as always, like I said, the point is well taken. We do know that that small businesses are looking, they're looking to reopen, and we're looking to get them reopened, but we want to do it in a safe way. Even the guidelines that were given from the White House and the guidelines that's given by Johns Hopkins about all these PPE, it's the biggest and most overarching part is that wearing PPE protects the most vulnerable population.
Malcolm?
Listening to all this, I sympathize with both Roberto and with Dawn, and I'm not comfortable right now of voting on this personally unless I really think it through, particularly an officer for each business, if we could take that out. And let someone, as we had before, someone working there as a COVID officer.
Yes, the COVID officer is someone who's already working there. We're not asking anyone to open anything new.
Yeah.
It's just in food establishments, it's the manager, the person in charge. Same thing goes with any other retail. We're not asking anyone to hire COVID officers.
Yeah.
We're not forcing anyone to open it, hire new people.
Helene?
Is there a way it can be phased? I think the wearing of masks is mandatory, and I'm 100% behind that. I think the occupancy may become an issue as we have more and more seasonal residents coming on island, and it may be something we could address at a later point.
Yeah, that can always be addressed at any time.
Mm-hmm.
I mean, right now, like Roberto said, those guidelines with the 40% for essential retail stores, those are in place.
Mm-hmm.
Change as this is ever evolving, I would guess so.
Mm-hmm.
If we want to remove just sections B and C and just do essential workers wear masks, section 2, post a sign requesting masks as a recommended practice. A, reiterate the governor's order on retail, and D, reiterate the governor's order on grocery.
Mm-hmm.
Rita?
I think it might be a good way to approach it, Roberto, just because B and C have elements that could probably use a little more public outreach and understanding the people that are going to be impacted by that. But I think that we could do the rest and then come back to B and C. I think particularly as things get more crowded, I don't think we should wait until we're sort of at full capacity to discuss this, but I think that looking at this is phased as well, because people are absorbing a lot of information and trying to adapt quickly. So I think putting the face mask in place and following with anything more that we want.
Yeah, B and C is, if B and C is the issue of interpretation, remove B and C, and we can revisit that later.
Mm-hmm.
Malcolm?
Yeah, I would be comfortable removing B and C, but I would not be comfortable if we wait too long on this.
Yeah.
And I would suggest that we schedule a meeting next week. We don't know what's going to come up. If we don't have an issue, we can not have the meeting. But I need to think about B and C a little bit, and I want to get my own input from the community. And at some point we may have to do it, but I think we should be prepared to do it as soon as we can if we have to.
Okay, so to confirm, Malcolm, just to be clear, we can remove B and C, put that on at a later meeting, but still implement 1, 2, A, and D.
I think that's what you're hearing from the board.
Mm-hmm.
But I think I would strongly suggest that we schedule a meeting in a week or so if we want to bring this up again. But who knows what else is going to happen between now and then that you need our input into. And that way we have the time slot. Just a suggestion.
Mm-hmm.
Anybody else? I mean, I would be fine with striking B and C for now too, and
I agree.
Revisiting the rest possibly at another time.
I agree.
I would agree, but I like Malcolm's point at sort of making it an urgent reevaluation as needed. And maybe, Roberto, next time we discuss it, if there's any further thoughts you've had on what businesses are impacted and how, I think that would be helpful.
Okay, so do we want to come back to the adoption of 7 after, and the rest of these orders after we hear from Gary? If anybody else have any questions about this, order 7. Malcolm?
Would it be possible to do the vote before Gary? Because I may have to leave.
It's up to the board. I'm good. Does somebody have to leave?
No, I'm good.
I'm fine.
You want to start from the top with the first, the construction phase order? Malcolm?
I move we adopt that order with the additions and subtractions that we discussed today.
Second.
Okay, seconded by Jimmy by roll call vote. Helene Weld.
Aye.
This is on order number 5. Rita Higgins.
This is on the landscape, the construction.
Yes. Yes.
Aye.
Malcolm McNabb.
Yes.
James Cooper.
Yes.
And chairman says aye. So construction order number 1 is adopted as written for the 21st with town council's corrections that will be added to it. Order number 6, can I get a motion for adoption for the landscape introduction phase 1, back to work?
I'll make that motion.
Can I get a second?
Second.
All in favor by roll call. Helene Weld.
Aye.
Rita Higgins.
No, I'm not comfortable. I'm still not comfortable with this for all the reasons that I've stated, so I'm voting no.
James Cooper.
Yes.
Malcolm McNabb.
Yes.
Chairman says aye. Yes. So that order number 6 is in effect with the corrections made by town council as of the date implicated, the 21st of April, 2020. Order number 7, the mass. Could I get a motion to accept order 7 with striking under section 2, B and C?
I'll make that motion.
Can I get a second?
Second.
All in favor by roll call. Helene Weld.
Aye.
Rita Higgins.
Aye.
James Cooper.
Aye.
Malcolm McNabb.
Aye.
And chairman says aye. So 7 is in to be, as with those stricken, and to be revisited potentially at a date. Rita? You're muted.
Just want to make a request. The Johns Hopkins document that was sent around to us was really helpful. I think that one of the things that really jumped out to me was this idea of aligning risk assessment. I think a month ago, we all aligned town admin, select board, hospital, board of health, and we looked at risk very similarly. And I think we're starting to lose it a bit. I think it's fair to say that the 5 select board all are assessing risk for these various things that are coming up very differently. I think the hospital's assessing it differently than the health department from the public. And I think while we managed to keep our cases to 11, I think as much as that's a major achievement, I think how we start to roll out getting people back to work, we've got to find a way to align how we all assess risk. And my comment, a lot of this comes from, I'm still very concerned about landscapers. And I just feel that last week, there was such a shift in how the hospital is assessing risk as to how the rest of us have been assessing risk and really upending our lives completely and entirely for a month. So that's my comment. I think it's something our board needs to do, the select board, the Board of Health, Department of Health, and administratively, because I think it's very frightening for the community and as leaders. We need to figure that out.
Okay, thanks. Gary, do you want to give us that update?
Just
Malcolm?
Chair, I'm going to leave you now. I have another meeting. I will talk to you soon.
Yeah. Gary?
Sure. Thank you. I couldn't agree more with Rita's comments and suggest that as we move through these next months, that we have agreement on, what are we facing and how do we navigate taking appropriate measured steps to move forward to reintroduce ourselves back into the world. I recently read a letter that was formed by, I believe, somebody in the construction business on the island. It was sent around. It was very articulate in identifying the work that's been done, not only to flatten the curve, but we basically pulled it out to a straight line. We haven't had any cases in 15 days. We're not having transmission on the island currently. We know we have people going back and forth to the mainland or still coming here. But we also see fantastic focus on social distancing and safety. And I know for a fact that there are many families and homes that have come from out of state that went right home, have stayed there, and have not contributed to spread. So I'm seeing a great amount of public awareness and measured concern on how you spread or don't spread, COVID. It's interesting when you look at how this whole epidemic really got legs in Boston and in New York. From the reading that I've done, it was largely spread rapidly through parties and through large gatherings in restaurants. When you have people in close proximity and you don't know you have something that is there 2 or 3 days before a person has clinical illness, it is somewhat of a ghost that you're dealing with. But we understand that much better now, and we understand how to prevent and take a distancing seriously. So as we navigate into this new unknown, a couple of questions do have to be answered for us to be able to do it without guessing. And so I would be remiss if I wasn't recommending to those above me or to my board about trying to reassess or assess the level of antibodies that are in our community circulating currently. To do that, we would have to be able to do a sample testing, and I've mentioned that once before. That would be a project that would go through our incident command at partners, and then, if approved, over to an IRB, which is a research board, so that we could then have access to resources to do some serology testing. So Dr. Drasden and I and others at the Mass General have been working long hours developing a written plan to do that. And Roberto's been involved in that as well. And what we are recommending is a 3-phase assessment of the community for those residents that are here now, primarily the permanent year-rounders. And if we are funded, which I believe we can be, and if we are approved, which I'm hopeful that we can be for a research project, then what we would be doing is moving towards taking a representative sample of the island that would give us a large confidence interval number. And that number would identify, how many people would be in that study. It would give us an understanding of, the prevalence of antibody now. And, what one of the things that's really interesting is that there's really nobody in the world that has ever taken on this kind of a disease, probably not in our lifetime. So it's challenging when you're trying to decide what steps to take. But finding out what we have circulating is important because it tells us what we probably already assume, and that's that we have a very low incidence of COVID on the island without transmitting. However, when we sample, we might find that people that are at home, in homes, or that have come here, did have COVID, didn't need symptoms to be treated, and didn't need to come in for screening, and we might have a higher incidence. That baseline helps us understand how aggressively you, the Board of Health, can consider measures to, open gradually or open faster. A second sampling would tell us how a migrating population coming in might increase that pool, and yet, as we start to look at that pool increasing, we know we'll see more COVID come back to the island. But the goal is to have a few cases at a time and aggressively use contact tracing, screening for people that have symptoms if they're positive, quarantine and contact tracing with a large, aggressive group of contact tracers, which Roberto and I have trained up, so we have that in place. And then a third sampling would be at the end of the summer to see what the population looks like and how much COVID is present. But the second stage is important because it allows us to understand better in the future and now how we would open up restaurants or those social establishments where you might have larger numbers of people, when to go back to school. All of those components are really important to understand in I believe, a three-phase a trial. So we're working to put that in place, have a high feeling of confidence that that can occur. The only thing that is occurring, the resources for doing that type of testing are limited. Right now, currently, we're projecting working with the Broad Institute through MIT that has a pretty good capacity. But as you know, Boston is also in the throes of still an epidemic, and they're using those resources as well. So we would have to be positioned in the mix and all of that. Important for us, yes. Do I think it's achievable? Yes. And that, I think, would then answer some questions that Rita alluded to about, what's our risk and what are we moving forward doing and why. I do think that the hospital is positioned right now well. Our shift in policy was due to the fact that as we learned about COVID, we as an island, weren't prepared from a healthcare perspective and had to take a number of rapid measures, plan through them, to be tactical about how we could address creating our drive-through to keep COVID hopefully out of the cottage hospital, and then to have their screening set up at the emergency room to keep COVID out of the hospital, get all of those things in place, start getting our screening process in place for testing, our testing materials in place, do our contact tracing training, getting that all in place, getting the community to help us get PPE and have that in place. So early on, our real urgent request was to make sure that we could just be prepared and if we had a caseload, be able to manage it. But knowing that the Boston epidemic would be occurring and that we wanted to bounce along underneath that with limited or potentially no cases, and you've achieved very, very few cases, so really flattening the line as a community. I do believe that as the death rate in Boston begins to drop, and when it drops, it'll drop dramatically. That'll probably be within about the next 10 days, is what I'm learning from the Boston public health professionals. That you'll feel people, you'll see people start to think that now we're okay and let's launch. And the worry is they'll launch here in great numbers. And we now have to be prepared with our messages on if you are returning to your home, welcome. But we would expect these social behaviors when you come back. We would expect that masks are worn, all of the things that you're talking about now, we would want to make sure that we've addressed those risk factors in a number of educational communications that could be at the ferries, could be at the airport, can be posted in all of the locations that have patrons coming in and out, so that folks can understand that we are basically really at risk, and without really understanding the amount of positive cases that have, or let me say, the antigen or antibody present on this island, what we want to do is not guess. We want to be sure that we understand what our risk is, because we could be sitting ducks without understanding that. So having a successful reentry program is addressed in the document that Rita was quoting some of the comments from. It's a well-written document. Actually, it's interesting that prior to receiving that, we've been following those processes. That's some of the information and skill set that I bring to the table, and Roberto does. So our planning is very much in alignment with what I'm seeing come out. But I know it's achievable. It's achievable in measured steps. We need to identify cases if they start early. We need to do those things which are screen them through the testing, quarantine, and aggressive contact tracing to keep the cases minimally low and not have an escalation. So I have every confidence in the work that you're doing. I believe you're taking the right steps. You're asking the right questions. We all are in this in kind of a big unknown. There's no roadmap for this. We look at the best information. We make an informed decision together. We're your hospital, and we go from there. So keep up, the focus. We're here for you. It takes time to navigate this, and unfortunately, this takes a while with a disease that takes so long to progress through a population. But it's the right work. There is a light at the end of this tunnel. I see it getting brighter. There will be a summer here, but it's going to be a different kind of summer. And I anticipate it will be people coming from out of state that will go to their properties and enjoy their families privately with social distancing at the beach and masks in public. And you probably making some recommendations as a Board of Health to minimize the types of groups and gatherings in public that we know have occurred in New York and Boston that actually spread the disease. Probably not going to be a year for socializing and having large gatherings on private residences. And if we can encourage people to understand that, have the right mindset about that, then we most likely won't have a problem that would overwhelm us with COVID. So I'd say keep doing the work you're doing. Those are great questions, and you're taking a good focus.
Thanks. That's well said, Gary. Does anybody have any questions for Gary? Yeah. Does anybody have, any of the board members have any other concerns besides what we went over today? Seeing none, thanks, Gary, for all that information. And one question I might just have for you, do you have any idea when, like, of a possible date, like this research could actually maybe begin? I'm sure you and Roberto are working hard to find this funding.
Yeah, so that's a great question. We would like things to start before the end of the month, but of course we have to be approved for it. We've been working since Thursday, pulling together a research team, and that would be individuals from the Mass General, Harvard, MIT, and the Broad Institute. Roberto's participated in those conversations where we were basically trying to define the scope of the study and a budget for those folks that need to know how much it will cost. And and move it forward. So we're refining it today, and then we hope to have an agreement with my team at the Cottage Hospital tomorrow, with Dr. Dresden, with Roberto, and then get it positioned in front of the Mass General Incident Command, and then from there, the next step would be the IRB, and that would be early next week. Once approved there, in the meantime, we'd be putting all the levers together to make sure that we could identify sample size, sample locations, order the materials. Some unknowns there as to how long it takes to get materials from MIT, probably a couple of days. So I'm projecting right around the end of the month, if we're approved, to have a start date.
That's great. Roberto, you have anything else to add to that, or are you good? I think Gary said it all. Okay.
I just want to say that Gary and I have been working together from basically when Gary had his first introductory meetings in about 90 days ago or 90 years ago, one of the two. And we've been really lockstep in a lot of the work that we've done, and I don't think we've had this sort of a close interaction and close teamwork between the health department and the hospital in a very long time. And it's very evident in 15 days with no new cases, and now collaborating on a research study with some of the largest names in medicine around the world. And it's something that Nantucket should be very proud of. Thank you.
Yes, great. Helene, did you have a question?
Yeah, I mean, I'm sure we've all been getting questions, and we're going to be launching phase 1 on Tuesday. Do we have a timetable for next steps? We're waiting for the governor to make a decision about the stay at home, or are restaurants going to be next up on the docket for opening? Just if there's any information or any thought on that.
Roberta?
I think that, yes, definitely restaurants are something that we really need to look into, and is definitely on the docket. My staff actually was today Sunday, 2 days ago, started reaching out to some restaurants and food establishments to get their feedback on the guidelines that were looked at on Wednesday. They're not ready to be released because they're just recommendations as of right now. What we're trying to do is to make sure that we are in concert with the guidelines that are coming out from the state and the feds, as well as us and our local group. We want to be in concert with what they're doing. It just, the risks are too high if we get this wrong. So as restaurants are next, retail and other types of establishments are after that, which should be really similar. And then also the May 4th date is still the date, but the governor might extend May 4th shelter in place. So we are at the mercy of that order, but we are definitely moving forward. The next phase would probably be food establishments.
Thanks.
Any other questions before we leave? Or okay, seeing none, I get a motion to adjourn this meeting.
So moved.
Second by Helene. Vote by roll call. Helene Weld.
Aye.
James Cooper.
Aye.
Rita Higgins.
Aye.
And Steve Visco says aye. Aye. Just like thank everybody that came on and left, and I think we made some good progress here.
Thank you, Steve.
Okay.
Good meeting.
Thanks, everybody.
Thank you. Take care.
Thank you all.